And I'm sure that most of you have seen the headlines of the Chronicle where there was a coronavirus case in Fort Bend County that was recognized yesterday. It is one thing when you watch on television, which all of us have done, of the various press conferences and all the situations that are occurring around this country, of course, and around the world. It takes on a totally different context when you realize that the affected patient lives only a few blocks from here. And something that occurred totally without any warning, notice, or anything of that nature. But I do have a press release which each of you may want to get a copy of. I'm going to read that, but I'm going to also then make a few comments. At that time, I will turn it over to our fire chief, Chief Larry D. Camillo, who's been with it from the first moment that we became aware that we had such a situation. So let me give you the overview, and then we will attempt to answer all of your questions. I guess the one thing that we have going for us is that when you've watched all these other press conferences, you realize they don't have all the answers either, and they're looking for answers. Well, we are too, but yesterday, the City of Stafford Office of Emergency Management was notified regarding a patient identified as a presumptive positive for the COVID-19 coronavirus. Test results were received after transport to a local hospital following treatment by the City of Stafford Fire Department and Fort Bend County EMS personnel. Immediate health and safety measures have been implemented for all of our first responder personnel who responded to this incident, and I can't emphasize enough how critical we feel that is, because these people are literally putting their health, safety, and lives on the line. At this time, the Houston laboratory, who concluded the presumptive positive test, has sent samples to the Centers for Disease Control and Prevention in Atlanta to perform further testing to either confirm, and we have not received the confirmation, a positive case, or to disqualify it. As always, the public should remain vigilant regarding proper measures to prevent the spread of any disease by following the guidelines provided by the CDC. These can be found on their website, www.cdc.gov/coronavirus. The City of Stafford Office of Emergency Management is continuing to monitor the ongoing situation and is working with Harris County Public Health, Fort Bend County Health and Human Services, Fort Bend County Office of Homeland Security and Emergency Management, as well as our federal partners as this situation evolves. The continuing goal of the City of Stafford is to safeguard the well-being, health, and security of our citizens, local businesses, employees, first responders, and unquestionably all persons who are in our city. I will, at this time, if you will, turn the presentation over to our fire chief, who, as I say, has been with this from the moment we received word about it. And he will answer the questions he can. I am certainly going to be available to answer any questions that I can. And we want this to be open and transparent. We've seen a lot of things. I've seen a lot of maps of the United States, but there isn't one in Texas. Now, I understand there may all of a sudden be some, but this is the first case, we believe, in Texas, and in view of that, we feel that is most significant to address it in a responsive manner. I'll just give you a comment and a call that I received around noon from one of our council members, and she said she was shopping in Sam's, which is right on the northern part of our city. She said people are shook up. She said they don't know what to do. She said we have to somehow communicate and inform them that we are on top of this. We're doing everything that we can, that we're going to be as vigilant and thorough, but also as responsive as possible. So with that, I'd like to ask Fire Chief Larry D. Camillo if he would come forward, and then he can give you truly some of the facts as they evolved and developed in this case. Thank you, Chief.
Thank you, Mayor. Good afternoon. As Mayor Scarcella outlined, we don't know as much as I would like to know. As a city, as a fire service professional, I'd be happy to ask any or answer any questions that you may have specific to this. Understand this is very early on. Obviously, the onset and our notification, as the mayor said, began just yesterday evening. And so whoever has any questions, I'd be happy to offer what I can.
So did you just get an initial call?
Yes.
How did it call? Somebody calls in respiratory distress, or
Yeah.
how did that go?
The way that this, the genesis of this entire incident in our city, and I'd like to qualify everything by saying that right now we are treating this as a presumptive case. Nothing has been confirmed by CDC Atlanta. This is all localized testing that's going on. Out of an abundance of caution, we're treating it as though it is. We have a duty to our citizens. I have a duty to my first responders to make sure that we are treating it accordingly, obviously. Specific to the incident, we received a call, typical emergency medical type call that we responded to in conjunction with our EMS partners to our neighborhood within our city, and it presented like any other.
And then an EMS type of hospital, or you?
Correct. Our personnel on board the fire truck assisted with patient care, packaging, and loading of the patient. We then returned to service. EMS transported to a local facility here in the Fort Bend County area. Additional testing and other steps were taken at the hospital, and then we were notified yesterday evening of this current initial stage.
Are there any safety measures that you take, or can you talk about those additionally that you take given the nature of this virus?
Specific to this, a number of weeks ago, we put out guidance to our personnel, made sure that we had inventories, in particular for respiratory protection, because obviously that's going to be the path of greatest transfer from patient to patient. We have done that. We've tried to increase the vigilance of our personnel as well as notification to just don't get complacent. You know, every run can be different. It may sound the same, but it's always going to be different. Specific to this incident, you know, all of our apparatus have the N95 mask. We have the protective gowns. We have the protective eyewear. We have spares. We have spares for spares. So we have all of the PPE that we need. And again, this is an incident that may prove out to not be the case, but we want to make sure that we're doing right by not only our personnel but our community.
So they were wearing that protective?
Yeah. Everybody that responded to that scene used the appropriate PPE, gloves, etc.
Was there any follow-up treatment for those first responders after they finished bringing the patients in the hospital?
No, they returned because of part of the patient assessment practice that we use. We obtain, obviously, pertinent medical history, travel history, etc. When certain dots line up, if you will, we want to make sure that we then take additional precautions. They return to the station, decontaminated as normal, restock their apparatus, and will return to service for the next call. At this point, CDC guidance dictates for fire and EMS that obviously until such time as you become symptomatic, hopefully that doesn't occur, it's business as usual per CDC guidance, and then obviously if that occurs, then we take the next steps.
Okay, so when did that first call happen?
It was in the morning of 2 days ago, the 3rd.
Okay. And what exactly was the call? You said
I think it was difficulty breathing.
it was difficult to read what the call?
Difficulty breathing
Oh, difficult to
was the nature of the call.
So what made them say, let's suit up with all of this protection?
When they made contact with the patient, what he was presenting with was symptoms, as well as travel history, medical history, etc.
Are you able to say where that patient was traveling?
I cannot.
when they arrived on the call, were they already wearing the mask, the gloves, or was that sort of?
No, our personnel never entered. The patient presented in a way to where our personnel never had to enter the residence, so where we were in fresh air environment the entire time. So they were donning their protective equipment as they were approaching the house.
So they've been responding to calls today as well?
No, ma'am. Their actually shift cycle is normal. They're off duty.
But when will these guys be back?
They're on their 4 days off.
4 days. And how many personnel are we talking?
3
3 personnel.
from the fire department, 2 from EMS.
What is it like to have this as a presumptive case right here?
What's it like to me personally, or as the fire chief?
The fire chief.
As a fire chief, it's disconcerting. I have 93 personnel I'm responsible for, and so when I go to bed at night, we need to make sure that we're doing everything we can for them and their families. The mayor, city council has always gone out of their way to make sure we have what we need, and consequently, that extends to making sure that in the course of their duty that we take care of them on the back end, should something like this happen.
And it sounds like you already prepared ahead of time, though. You kind of had it mentally.
You can always be prepared mentally. You can have procedural documents and guidelines in place. When you get down to it, it's only as good as how it's followed. And our guys our guys and girls do an excellent job every day. And it's just one of those things. It's part of the job, serving the community.
The neighbors were notified that
No.
it was so stuff like that?
No, sir.
How many other people are in the house with this individual?
I cannot answer that question. I
Have
do
they
not
been
know.
tested?
No. Actually, I can't answer that. I do not know.
Is this case at all connected with the 2 in Northwest Harris County?
I will allow Fort Bend County HHS to lead into that and answer that question.
Can you provide any more insight on that man's condition once firefighters arrived?
He was ambulatory. He was talking. There was nothing that would indicate it was critical in nature at that time.
So if these firefighters wanted to take time off or quarantine themselves, can they?
Sure.
Okay. But
I
they
can't
don't-
control what they do on their days off.
Okay, but I'm saying in 4 days, when do they come back to work?
Their shift cycle, Chief Magani, when do they return back to work? Sunday.
Sunday. Okay. So, I mean, they could have contracted the virus from him.
That is one theory, but we could also go down the path of CDC results could come back late today or tomorrow and rule it out completely.
So if we get those results and he is positive, sure, if they get the results that he is positive, are they going to be quarantined?
At that point, CDC guidance states that all personnel are not to be quarantined until they become symptomatic, is what current CDC guidelines are in conjunction with our medical director.
And so was it the EMS, so you guys, just to be clear, because I saw it's an EMS transport, were you the EMS transport, or that was separate?
No, separate agency. Fort Bend County EMS provides the EMS transport for the entire county.
Okay, so you just were the initial first responders on scene?
Correct. We respond to assist on certain classifications of calls.
I have a question.
Yes, ma'am.
Any idea how many people in the city are being quarantined who've had contact with him with this symptom?
The only people that have been considered, and the chief can respond directly on that, for the potential for quarantine have been those that were involved. Chief, you want to?
Yes, sir, I will. I'd be happy to. Specific to your question, quarantine, just to be frank, let's look at King County, Washington. And you hear in the news that there's 27 firefighters and 2 police officers that have been quarantined. There's huge differences between the situations. Those personnel are symptomatic. Those people made repeated calls to the same facility. They entered their same facility, made contact with the same contaminated surfaces. There's a myriad of reasons why this is far different. As it stands right now, that has been confirmed in King County, Washington. Here locally, nothing has been confirmed. This was a test that was done local, and CDC Atlanta has yet to say yes or no. So to presume that this is, and to automatically assume that we must start quarantining vast swaths of our city on maybes, I think is premature. But at the same time, too, we're also pushing out information to make sure that our population, our employees, our businesses are educated.
Are there any other human contacts that this person had that you guys are investigating or looking at?
You have to understand our responsibility is to provide immediate care for the patient. After that, we turn them over to EMS. We make sure that they get to the ER and receive the appropriate level of care. After that, we kind of step back. Fort Bend County Health and Human Services, in conjunction with CDC and everything else, would do any social contact tracing and path discovery would all go to them.
Okay, but now there's people in Stafford who are gonna be calling firefighters, so they're gonna need service from firefighters
Sure.
on Sunday.
Mhm.
And they're gonna be wondering whether the firefighters potentially contracting coronavirus are gonna be showing up at their door. If I'm taking.
I think that's a
test
stretch, but yes, go ahead.
People are already thinking of those thoughts. People
Oh,
are-
absolutely.
They're thinking a lot about.
Which is why we're here today.
Right, so just to be completely transparent about it.
Please.
If this guy, if CDC comes back
Mhm.
and says, yes, he does have
Right.
COVID-19,
Mhm.
what's the plan in the fire department?
The plan within the fire department is in consultation with Fort Bend County Health and Human Services, CDC, our medical direction, Dr. Joanne Zeldua, in conjunction with city leadership, Mayor Scarcella, and city council. We will then take the CDC guidance and take the next steps to first and foremost make sure that our personnel receive the care they need, that we do not have anything that goes beyond that in terms of a spreading or a continued evolution of this process. And I can assure you, I can assure the citizens of the city, I'm not going to allow any personnel that are on a fire truck that are going to go out there, they're going to put them at risk.
All right, do we have any additional questions or comments? Yes, sir.
How are you guys handling questions from the public? I know the Fort Bend Health Department has set up the phone bank to answer those questions from the public, but when you say something like a council member says she's noticing that people in the community are shook up, how do you guys handle that? How do you address that?
We are not going to have a hotline or anything else. We have a TV station that everybody in the town can get watch it, but the main thing we want to do is to communicate to the citizens of Stafford, the business people. And remember, we have 19,000 people roughly in the city, but we have over 50,000 people that work and come here for various services, including going to In-N-Out Burger. What we want to make sure is that we communicate the same information on a very responsible basis. Let me just, and I'm going to hearken back to what I said at the opening. All of you, and myself included, the chief and everybody else in this room, have seen all kinds of presentations, discussions, whatever. Yesterday I watched for over an hour the Vice President of the United States go on this. We don't have answers that other people have yet to develop or come up with. But in view of our proximity and close involvement with this particular situation, which I can tell you on Tuesday, we didn't have an inkling that this might be something we had to be concerned about. Here yesterday, it all unfolds. Today, I was getting calls from council members and others. What are we going to do to inform the public? They're scared. Well, how do we communicate with? You can't talk to each and every one, and to try to answer every question by phone is simply non-effective. What I do want to tell you is that this city, including our Councilwoman Alice Chin, Chief D. Camillo, the police department, everyone else, is trying to be as open and as forthright with the citizens as we can while communicating in the most responsible way that we can. That is the key. And we invite you and encourage you to watch all of this other. Dr. Fauci is on there with the president or the vice president, whatever else. Whomever can give you information on this. But we don't have any magic source. We certainly don't know of any development of a serum or anything else. What we do know is the people need to be responsible. The president said he hadn't touched his face in 3 days. This I have a hard time believing. But we are trying to encourage everybody, wash your hands for 20 seconds. If you've ever done that and actually measured those 20 seconds, you see it's a little longer than you normally wash your hands. But whatever it takes to encourage people to be safe and to be very cautious and to be very responsible and recognize the potential for problems in this area, that's what we're going to be doing. And that has to be our function. Now, the chief, and he can give you more elaboration if you want it, but in regard to our first responders and in regard to the people that are having to go to others that may have a condition, then we have to be exceedingly careful, and we have to be exceedingly thorough in making sure we do everything to protect them because they are protecting us.
Mayor, if I may.
Sure.
If nobody has anything else for the mayor, I'd just like to wrap it up and say a couple of things. I certainly hope that all of your time, and while we appreciate you coming here, I hope it was all for naught. To be quite honest with you, I hope that at the end of the day, nothing comes back confirmed from CDC Atlanta, that this was just all an exercise in hypervigilance, and that hopefully at the end of the day, we wind up being able to move on. There is no need for hysteria. There is no need for widespread concern that this is going from house to house, doorstep to doorstep. This is not how this works. The mayor wanted to make sure that we communicated as much information as we could, just from an abundance of caution, because it may or may not be accurate. It may or may not come back as confirmed. And that's all this is. We cannot state it is. We cannot state it isn't. But at the same time, too, the information that we've been receiving from other agencies in Fort Bend County led us to where we are today.
Thank you all so much for coming.